Hello everyone. So today I'm going to be talking about three things. One is tips for residency. Most importantly, what are important things which can make residency more smoother. Initial 6 to 7 months are kind of little, challenging, but after that things become smooth. So talking a little bit about those tips. The second thing is extra tips outside the residency, what things to consider. For example, if you're starting residency, and hopefully you will match, and you're planning to start the residency, so what things to consider before the start of residency, and tips as a resident. Okay, so the first thing is get a handbook, right? There are a couple of handbooks. If this is mostly about internal medicine, so if you are starting residency, try to get the most updated version of Massachusetts handbook. Every year or couple of years new edition comes, so that would be important, or any internal medicine handbook, or your subspecialty handbook, which is kind of handy, small, pocket size, which is it's in your pocket, and whenever time comes you want to do some referral or want to see some management, that's good, right? So this is important. If you want me to talk a little bit about common handbooks we used, let me know. I can comment. The second thing is up to date. Up to date gonna be your best friend, but don't worry about it, because this gonna be provided, mostly it's provided by the residency program. Clinical Key or Up to Date, those common online resources. So try to kind of use this. Common conditions like COPD, CHF, UTI, those are common things. You can see management doses and those things, right? So that's important. The third thing gonna be Apocryphs. Apocryphs is a app which you can just download, and you can see different doses of those of the medications, common medications. So that's gonna be one free app you can use. The second thing gonna be learn your EMR. So that's very important. The EMR which you're gonna be using, either it's Epic or Sunrise, or it's Meditech. Any EMR, if you already know it, that's easier. But at the time you're gonna learn it, but that would be very, very important. Know the shortcuts, how to see the vitals, input, outputs, labs, images, and those things, and past records. So that would be important, because that helps you. If you want, I can make a little video about how to review a patient, because that's very important. How to review a patient, I would say, more efficiently, right? So that is very important. So that would be good if you kind of are handy on it, and the shortcuts, how to see and review a patient. The other thing gonna be listening to lectures, or reading the consultant notes. These are small things which helps you to be a better clinician, and to make your judgment very sound and clinical. So that's very important. Mixup is a question bank which can be provided by your residency program. So try to do a couple of questions every day, or whichever rotation you are on. Usually what I did is that, for example, if I am on my floors or night float, I used to do IEM questions, internal medicine questions, or general medicine. And then if I am on any rotations, let's say cardio rotations, then I do all the EKGs and all the cardio questions. If I'm on rheumatology, I did rheumatology questions. So that's important also, because if you are stuck on a question, you can ask the consultant right away, and they're very helpful. They are more than happy, and they also enjoy answering those questions. The other thing is what I did is that getting an iPad. Don't rush on, because sometimes program do reimburse you. So if you get an iPad during residency, just ask the program first, or if you can afford it, then iPad would be nice, like a handy one, a pocket size one, and you can download that app, like the EMR which you're using, do a remote access on that iPad, and when you're rounding, you can just open the patient kind of account, and you can review the or put in the orders. For example, if they're rounding and they said, hey, let's do a calculation profile, or let's do a ESR on this patient, you just right away put those in, so that you don't have to kind of wait after the rounds and then log in and then again put those orders. So that's something which is more efficient. It's gonna make you more efficient because right away you put in the orders. And sometimes what happens, you are rounding and consultants haven't seen the patient, and if you have an iPad and meanwhile you reach on that patient during the rounds with your attending, and the consultant notes pops up, so immediately you can just update your attending, hey, GI is saying this, or cardiology cleared the patient for discharge, and right away that makes things more smoother and easier. So this is like a plus, for your rounds to be more efficient. So that's important. Beside this, I would say from day one, think about how you're gonna discharge the patient. Like, let's say if a patient came with a UTI, you started the management and everything, but think about the discharge. Like, are you discharging the patient on antibiotics? Does the patient have insurance? Is he able to afford it? If no, do a case manager consult. Make sure the scripts are provided to the case manager, close to the discharge, so they can work on the medications. Or if, let's say, physical therapy said the patient gonna go to a rehab or patient gonna go to a home health, make sure those forms are signed. During residency, attending signs it. Sometimes residents have the liberty of signing it, so make sure those are signed, so that when the discharge comes, there is no any hiccup or any delays. So that's important. So think about those discharges on the first day. These are a couple of things which going to help you during residency. The second thing which I'm going to talk about is the extra points. Now, extra point means extra, I would say, tips outside the residency. Now, wherever your hospital is, try to rent. Again, it's up to, every person is different. Every individual have different preferences and family preferences. But, the best bet is to, if you can, then just rent an apartment which is as close to the hospital. My apartment was just across the street, so this would be so helpful, because the most time you're off, you want to either stay home, or you want to sleep, or you want to just just relax. So that would be important, especially in the first year. I would say consider that thing, rather than staying in the downtown area, which might be 20-30 minutes from the hospital, and the traffic and everything. So consider those things. These are very important when you choose your place to rent or stay. So the best bet would be to start moving or planning to move. Again, everyone is different, 2 to 3 weeks prior to starting of residency. Now, residency starts on 1st July. So usually what happens, every program is different, but they call you 7 to 10 days before. They're going to be like a medical, and then they're going to be orientation, white course ceremony, and those bunch of stuff. So the best thing is consider a few weeks before July, so at least you can just settle down. And it's important to see if there is bank around, or grocery, some restaurants. So those things are important. Make sure where you rent a place, these things are close by. Opening a bank account and that basic stuff, that would be important before the residency starts. The second thing I would say is having a car and a driving license. That's important. Now, if you're renting a place across the street or very close or walking distance, that's okay. But then what happens is you have to go to outpatient clinics. And it depends on, we had like 6 to 7 different clinics, 20 minutes away, one was 5 minutes away, one was 30 minutes away. So it just depends on which clinics you're going to be rotating in, and then ask the GME, graduate medical education department, about the clinics, how far they are, so at least you have an idea, and then you are ready for that. It's not like at end time you don't know how to now commute to the clinic. So that would be important. Now, the third thing I was saying here, tips as a resident. This is very, very important to survive 3 years during residency. The first thing is that you have to be positive. right? This is just a phase of life. It will get better. So that's important to kind of acknowledge. The second thing is, there are going to be a lot of gossip during residency, a lot of backbiting, like bullying and that stuff. um, don't isolate yourself. I would say that, just listen, but don't talk or don't be a part of it. So just try to avoid it as much as possible. So this is gonna be very, very important, gonna save you from like fights, from those little things which can be challenging at the workplace. So just try to avoid gossiping and then those that stuff. Never try to act smart. This is very, very important. I've seen so many residents never try to act smart, because honestly, consultants, colleagues, team workers, they figure out, because they have been seeing this, and everyone is mature there. There were a couple of residents who kind of read their articles the night before, and they come in the morning and vomit all those articles in front of the team and the consultant to just try to impress them. Don't, I would say, if you know it, that's good. Just say, hey, I want to just add on this stuff which I just read recently, hope that will help you. But don't try to try to act smarts, because everyone realized that, right? So this is something which also helps you during the match season and interviews also. Don't never try to act smart. So that's one thing. The other thing is, be a team player. If someone want to leave early, or just try to accommodate those things. Just try to be a team player, and that's the one thing which they see during um, uh, you know during the match. The other thing I would say is that thank you, appreciate, it's okay, sorry. Those are the phases gonna help you a lot during residency. Stay away from controversy. That's the most important thing I would say.